Hi, we are from PHD214 presenting PHD214 Antipsychotic Drugs of Dementia. But first, let me introduce you my teams. Me, Nurdana Farisha, Hanis Humaira, Siti Suhaida, Damia Putri, and lastly, Christinis. Okay, so let's dig in. There are two antipsychotic drugs that we will be discussing in this video, which are risperidone and olanzapine. And also we'll be talking about their mechanism of actions, route of administration, side effect and management, and lastly, drug-drug interactions. But before that, do you know what is dementia? Dementia refers to a condition or a disorder that impact our memory, decision-making, and also ability to perform daily activities. Risperidone and olanzapine falls under the category of a typical antipsychotic drug class. For risperidone, it works by managing certain mood disorder including schizophrenia, bipolar disorder, and also symptoms of dementia. It works by help to recover the natural substance in the brain. For olanzapine, it will help to manage the behavioral disorders in elders with dementia, treat symptoms of schizophrenia and adolescent, and it also treats bipolar disorders. It will help by regulate brain function by changing the activities of natural substance.
So for our mechanism of actions, both of the drugs, our risperidone and olanzapine, have the same mechanisms, but their modus variation in terms of their affinity in receptors targeting differs, which will impact their applications and adverse effect. So first of all, risperidone and olanzapine block the D2 receptors, D2 dopamine receptors, which will then reduce dopamine in the brain. So in schizophrenia, excess dopamine in the mescaline pathway will cause symptoms like delusion and hallucinations. So by lowering its overactivity, risperidone and olanzapine will help manage the symptoms and improve mental health. So for the second one, risperidone and olanzapine will block 5-HT2A serotonin receptors, which will then increase dopamine in the prefrontal cortex. So this increased dopamine will help reduce negative symptoms like emotional flatness and improve mood and cognitive functions.
We're going to talk about routes of administration for risperidone and olanzapine. For risperidone, we have two forms, oral form and injectable form. Oral form is by mouth, like tablet, solution, or dissolvable. The tablet should kite, chew, or disintegrating its formulation. For injectable form, they have long-acting, which is by into a muscle, Pessaris, which is by under the skin, and Uzedy, which is inject subcutaneously. Injection only given by healthcare provider only. And next, we're going to talk about olanzapine. Olanzapine have oral form, which is tablet, and orally disintegrating tablet. Tablet that dissolve quickly in the mouth. It's usually taken a day with or without food and be taken around the same time every day.
Now, I'm gonna talk about side effects and management. Firstly, for risperidone, the first side effect is sedation, where a person will feel sleepy. Sedation happens due to overdosage of the drug, so to manage this, patient need to reduce the dose of the drug. Next is extrapyramidal symptoms, which mean abnormalities of movement. To manage this, patient can discontinue the use of the drug or administer anticholinergic medications. For olanzapine drug, the side effects are metabolic effects such as reducing insulin sensitivity and abnormal lipid profiles. Management of these side effects are always monitor blood glucose level and practice healthy lifestyle. Second side effect is orthostatic hypotension, which means blood pressure falls when standing, then lead to dizziness. To manage this, patients need to stay hydrated and monitor their blood pressure regularly.
Drug interactions, there are various of drugs that cannot combine with antipsychotics, which can lead to side effects to the patients. So for the first one is central nervous system depressions such as benzodiazepine, opioids, and antihistamine. They are additive sedations, which can lead to reduced central nervous system activity, leading increase in drowsiness. So there are also respiratory depressions, and the patient also have the potential for overdose. Next, we have cytochrome P450 enzyme interactions, in which most antipsychotics are metabolized in the liver by CYP450. So inhibitors included are rifampin, carbamazepine, phenytoin, and St. John worts drugs, which can reduce antipsychotic level. So for the other inhibitors such as fluoxetine, paroxetine, and ketoconazole, can increase antipsychotic levels. For the third one is antihypertensive drugs such as beta blockers, diuretics, and calcium channel blockers, or known as CCB. It can lead to excessive hypotension or bradycardia when combined with propranolol. So they are also additive dizziness to the patients. So for the next one, we have anticholinergic drugs such as benztropine, diphenhydramine, and tricyclic antidepressants. They are lead to additive anticholinergic effects in which the patients will have tremor, constipations, urinary retentions, or confusions. They are also increased cognitive impairment and also lead to gastrointestinal effect in which the patients will have a severe constipation. Last but not least, we have antimuscarinic drugs, for example, benztropine, same with anticholinergic drugs. Trihexyphenidyl, anti-Parkinson drugs. It can lead to delirious when the combinations of antipsychotic and anti-Parkinson drugs. So the combination will lead to cardiovascular effect, which is increase the risk of tachycardia in the patient.